Hi, everybody. Judy Seeger here, your host for the Ozone Therapy Summit. So glad to have you guys back on here. We have another guest on here that I know you're going to get a lot of information about ozone therapy and practical things that he has created himself. I'm very excited to share these things with you. Because the thing about ozone therapy is while we know it's a powerful therapy, we want to know the best ways to use it. So we have on here Dr. Frank Shallenberger from Nevada. Thank you so much for being on here, Dr. Shallenberger.
Thanks for having me, Judy.
Yeah, and so you've been, just so a little background so everybody knows, you've been a medical doctor since 1973, and you have been doing ozone since 1983. So that is a long time. Like we have the best of the best on here. This is really awesome. So tell us a little bit about the whole thing with why did you get into ozone therapy?
Well, back in the early 80s, uh, you know, right on the edge of medical science was this whole concept of oxidant stress, and oxidant stress causing diseases and free radicals. And I was one of those guys that just thought you need to give everybody antioxidants. This is going to cure everything. This is what's going to make it all work. And lo and behold, I was putting together a conference back then, and I learned about ozone therapy. And ozone's a very powerful oxidant, and so it struck me as something's wrong here. Something doesn't really equate out, because here you have oxidant stress. Excess oxidation is supposed to be causing disease, and then you got doctors in Germany that are given something that's a powerful oxidant and they're curing disease. What's up with that? So that's why I went over to Germany back in '83 and took a class from some of the world leaders back then. You might have heard of Renata Vebon. I don't know if you guys have
I have,
interviewed her,
but
but
yeah, no, yeah, no,
yeah, she goes all the way back. Her dad, in fact, was the first inventor of the modern ozone generator. And so she was my teacher. She taught us all about stuff, and I came home and I said, wow, this is really something. And so we started using it back in '83. Never
wow. So
stopped.
yeah, and see, that's people don't even know that these ozone therapy clinics and docs have been around for so long. I just had somebody
Yeah.
today. It says, "How come this is not around?" It's like we're working on it.
You know what? It's fascinating. Ozone is one of the things that's so attractive about it is its history. And it goes back to the mid 1800s. I don't think a lot of people know this, but none other than Werner von Siemens, who's one of the more famous. In fact, in Europe, they consider him the chief architect of electrical engineering. He was a big user of ozone therapy. He developed the first ozone generator. Uh, Nikola Tesla.
I was going to say, wasn't Tesla the one who actually made that little generator and got
Yeah,
things going?
one
Yeah,
of the all-time geniuses of all time.
yeah.
Was big in ozone. He made the first ozone generator for medical use back in 1906. He patented and made that. He's got a rich history with ozone therapy. The University of Chicago, University of Florida, back in the late 1800s, published papers on ozone therapy. And I could go on and on for about 2 hours on just the remarkable history of ozone. And
Right.
it is remarkable that it's not very well known, but it's not so remarkable until you realize that the pharmaceutical industry controls medicine and everything that people know. So they're not going to tell you about it.
No, and there's no money in it. I mean,
Yeah,
medication is, they mark it up 100% to 1,000%, and that's where the money is. But ozone is oxidant, and how is that going to work? They're not
no,
going to make money on that. So that's really the issue
exactly.
there. So let's get down to the basics. I ask all my experts to explain it in their own words. What is ozone therapy?
Ah, good question. Okay, so what ozone therapy is you apply ozone to people and or animals actually, and now how you apply it, you can apply it in a lot of different ways. But ozone is it's oxygen. Normally, the oxygen that we're breathing in the air is O2, so that means it's two oxygen atoms together. Ozone's O3. But it is pure oxygen. It just happens to have that extra oxygen atom in the molecule. And that's what makes it so powerful. So it's got three atoms instead of two. That makes it a lot more powerful than regular oxygen. Regular oxygen will not do any of the things that ozone does. But we apply it to people. We can certainly, one of the major ways is you apply it to their blood. So you'll take blood out of the body, inject ozone into the blood. The blood will be treated in that way, and then you reinfuse that blood. That's probably one of the classic ways to use it. We can also use it across the skin in a sauna type of setup. We can give it in an intestinal version, say as an enema or with a colonic. We can make ozonated water. Water will trap ozone in it, in similar to the way, say, a soda pop traps carbon dioxide. And so that when you drink the soda pop, you're drinking carbon dioxide. You can make ozone water. So when you drink this water, you're drinking ozone, which is a gas, by the way. So you can apply it that way. Nikola Tesla invented the concept of ozonating oils and then taking the oils internally and or applying them to your skin. You can inject ozone into ears. One of the things I've kind of pioneered is the idea of injecting it into joints and muscles and spine and backs and bursas and feet and
Definitely want to get into that. Yeah,
you can put it in bladders, you can put it in vaginas.
I know, that's the cool part.
There's virtually no place you can't put it.
So just to, and we're going to talk about the therapies that you really put ozone on the map for, and with pain and joint and all that. But I just want to lay the foundation with the way that you're using ozone in your practice, and what kind of benefits are you seeing with the people? Like, give us some examples of people that have been using ozone, you work with them and injecting it, and because people a little bit like, hey, what are you injecting into my blood, and what does it do in my body, right? So yeah.
Well, I guess the first thing that comes to mind is that for the most part, if you came to my clinic, for the most part, what you're going to find is that my patients are getting all kinds of therapies, anywhere from conventional therapies to alternative therapy like herbs and vitamins and so forth and so on, just like you would see in any other clinic, except we're always adding ozone in there. And what ozone is, it's the catalyst that makes everything else work better. So in a sense, it doesn't matter if you're a cardiologist, an ophthalmologist, if you're a gastroenterologist, or what urology is. It doesn't really matter, because if you just keep doing what you're doing and you add this incredible therapy to what you're doing, your results are inevitably much better. And it can be used across the board, Judy, in virtually every single application.
So with Dr. Shallenberger, now some people are concerned that there's contraindications, that if you do it with medication, it could cause problems, or if you do it with vitamin C IVs, you're not supposed to. So let's clarify that.
Okay.
You said that it was safe, but people are a little bit confused that maybe it shouldn't be used at the same time.
The contraindications of ozone therapy are well known, well described. There's just a few of them. One of them is very low platelets. If a person has a disease with very low platelets, you got to be a little bit careful. There's a certain enzyme deficiency called the G6PD. If they have a deficiency of that enzyme, you got to be a little careful. But other than this, you can use it with any drug, any condition. It doesn't matter. The trick is to find the right dose and to find the right way you want to put it in that person, whether it's via the blood, via the bladder, or whatever. But it can be used literally with everybody. It's very few contraindications.
Yeah, I mean, the studies, when you look at the European studies, the side effects are like 0.00000.
Yeah, it's crazy.
Whereas medication it's ridiculous, the side effects. So the benefits, what kind of benefits? Like, do you stand out that they came in one way, you did ozone, and of course you made a very valid point that you have to combine other therapies and nutrition, all that, whenever you do it. It's not a magic bullet, but it certainly is a big bullet there. What kind of benefits specifically of people that you work with have you seen?
Okay, before I get to that benefit question, I'm going to kind of go back a little bit, because I didn't really answer your question about the vitamin C.
Okay.
Yeah, so what you want to do, you can use vitamin C with ozone. You can use it on the same day. You can use any antioxidant therapy with ozone on the same day, but always after the ozone treatment, never before. If you use it before, it'll interfere with the way ozone works.
So vitamin C after.
Always, any like glutathione, for example, but any antioxidant therapy, just after, never before, and then you're good.
Gotcha. Thank you for clarifying that. That's a good point.
In terms about what its effects are, These are well described. I go over them in my book in detail, but in essence, probably the number one effect is it's a potent mitochondrial stimulant. It will revive damaged or impaired mitochondria.
Okay, so hold on. Before we go another step, let's clarify what is the mitochondria, what is the function, because we're not
Okay.
talking to doctors, right?
Okay, so yeah, we could go on for this for a long time, but
Yeah.
let's make this a little short,
Yeah.
and just say that in each and every one of your cells, there's one exception, that's red blood cells. But in each and every one of your cells, almost half the cell is made up of these things called mitochondria. They're little bubble-like structures, and in there is where all that oxygen you're breathing, that's where it's headed. It's going to find its way into your cells, look around in the cell, find a mitochondria. It's going to enter into the mitochondria. And in the mitochondria is where your cells get to access the energy in oxygen. Oxygen's an energy supplier for us. And so in the mitochondria, we can extract that energy from the oxygen. We can harness it and then use it to keep us alive. The problem is with mitochondria, for a lot of reasons, not the least of which is just having birthdays, your mitochondrial function is going to decrease in efficiency, which means that you're not going to get as much energy out of that oxygen you're taking in when you're, say, 70 as you were when you were 40. There's a number of other conditions that impair this too, like heavy metals, and probably you just go through the list of all the things that everybody knows is bad for you, from stress to toxins. All those things are bad for you because they poison your mitochondrial function. So the essence of this is these little bubbles, these little mitochondria in your cells, if they're not working efficiently, that is the sort of that is the major single factor in why people become frail, weak, more susceptible to disease as we get older. That's why people, even younger, like 35, 40-ish, you meet people that aren't doing well or having a problem or another. It's always underlying that as a mitochondrial disorder. So anytime you can improve the mitochondrial disorder, you're actually improving a major factor in their disorder.
Yeah, and people have no clue. They're taking supplements and eating and all these different things, and they think that that's enough. And I'm like, you guys don't know what's happening on the cellular level, and that's one of the most important things that you need to look at. So, yeah. So here's the thing: you've developed all different for the pain and then for the mitochondria because people want to know how to monitor and know, well, how do I know how my cells are doing? And they say, well, let's just go get a blood test. But that's not really enough, right? So you've developed something else I want you to share with everybody.
Yeah, I am so excited about this. About 20 years ago, I had been using Ozone for a decade, and I was realizing, this stuff, remarkably enough, is important for fixing almost every disease there is. And I was contemplating that. I said, how can that be? Nothing you ever hear of fixes every disease. Come on. And it was then that I realized through my studies that the reason is because every disease is characterized by decreased mitochondrial function, and Ozone's working on that level. So I thought, what we need to do? We need to find a way to determine mitochondrial function, a way to measure it. So I developed a system that uses what we call a VO2 measurement device. A VO2 measurement device is going to measure how much oxygen your body's taking in, and in real time, how much carbon dioxide is putting out. Basically, you wear kind of like a scuba mask. And as you're breathing through this device, it's connected to this analyzer. And then we take that data, and that determines mitochondrial function. As your mitochondrial function becomes poorer, two things happen. One is you don't process oxygen as efficiently. So the amount of oxygen disappearing in your body decreases. We can measure this. And as your mitochondrial function becomes less and less efficient, you produce more carbon dioxide for the amount of oxygen going in. So if you look at the ratio of carbon dioxide to oxygen, you can also determine mitochondrial efficiency. So we use this device, we established all the normals, and I can plug you in, and in about 45 minutes, I'll tell you how efficiently your mitochondria are working.
So then that determines the next step of how much ozone you need or how much anything you need really to build up the mitochondria.
Well, it's so important because you know, a lot of people, you know, they think the medicine's all about therapy. You know, you got to have some treatment, and there's no doubt about it. If you don't have a treatment, you're in trouble. But even more important than having the therapy is having the way to diagnose the condition. Because if you can't diagnose the condition, you don't even know to give the therapy.
Right.
So ozone, and you know, a good example of this is blood pressure. Most people who have high blood pressure have no clue. You know, they just take their blood pressure. And finally, somebody says, "Look, your blood pressure is really high." That's probably true for 9 out of 10 people. And yet, so if you don't have a blood pressure cuff, you can have all the blood pressure therapies in the world, but if you don't have a blood pressure cuff, you don't know two things. Number one, you don't even know that person ought to be treated. You can't even get on first base. And number two, when you are treating them, you don't even know if your treatment's working. So if I have a patient coming in and I measure their mitochondrial function and it's great, I can look at that patient, I could say, you know what? The way you eat, the way you take care of your life, your nutritional status, the way you deal with stress, your hormonal issues, your toxicity issues, all those things, pretty darn good. Everything's working. On the other hand, if they test out poorly, I could say, look, I don't care what you're doing. You might be taking every known vitamin you ever read about. You may be eating such and such a way or whatever, but you got a problem. So we've identified a problem. Now we can go about with the treatment.
That's brilliant. And so, is it, you have this in your clinic, I imagine. Do
Yeah.
other doctors have it in other parts of the world that people could go to?
Yes. Yeah. People can go to a website. I call it bioenergy testing. That's what I call it. People can go to that website, www.bioenergytesting.com, and find a list of doctors and clinics. Most of them are in the US, but there's a couple in Canada. I think there's a couple outside of the US. And find a doctor that is offering this kind of testing for the patients. But I look forward to the day when literally this is a standard part of testing protocol for everybody.
Yeah, that's brilliant. And your clinic, I know, is in Nevada, but what is your website if people want to get a hold of you to get more information about this?
Okay. Yeah, and you know, I have a lot of videos and informational things on that
Yeah, I
website.
send people to
It's
you all
pretty
the
easy to
time.
remember. It's anti-aging medicine. So it's just antiagingmedicine.com.
Yeah, there you go. Okay, so as far as this other part that you've developed, which is for pain, you actually have this whole ozone way of using ozone that goes right into the joints so that when people have
Yeah.
pain and inflammation. So explain that to us and what that's all about.
When I was back in Germany, back in 83, one of the things they told me was that if you have a patient with rheumatoid arthritis, and they have a big swollen, inflamed, painful knee, you can inject ozone in there and it'll treat that, take away the pain. So we came back to the U.S. and at one point I had a person come in, a patient came in with a rheumatoid arthritic knee. As fate would have it, I injected the ozone in there, and darn if it didn't fix it right up. And so I did that patient for a while. And she was all happy. Her rheumatoid, which only happened to be in her knees, was completely gone. And the next thing you know, her next door neighbor comes in and says, you know, I've got a really bad knee here, and I want you to inject it like you did my friend. And I argued with her a little bit. I said, you know, your friend has rheumatoid arthritis. You have osteoarthritis. You just got an bad old wrecked knee. They're totally different. You know, I can't tell you for sure I'm going to help you at all. And she says, look, you're going to make me any worse? I said, no, I'm not going to make it any worse. She says, well, do it anyway. I don't know. So she talked me into it. I injected her knee. She calls me up. She says, my knee feels great. So I learned that there's something about this that's just pain relieving. And I started doing more, the word got around, I started doing more and more knees. Well, finally, one of the patients says, you know what, every time you inject that ozone in there, it hurts. And it really does. It hurts a lot, which is one way that I knew my patients must be getting better, because they keep on coming back for more. And it's quite painful. So the
Well, so
patient,
why is it when you first inject it is painful? Why is it painful in the beginning?
it's an oxidant. It's like a caustic material, and these people already have pain there, so it just is irritating. Let me put it. It's an irritant.
Right. And so
Okay.
how long does that last, that kind of thing?
About, it's not horrible, like maybe 5 minutes.
Oh.
It's quite
Yeah,
painful for about 5 minutes.
5 minutes. Okay. And
And
that's
then
what
the
people
ironic
really,
thing is the pain that they came in with actually ends up going away. But
right.
for those 5 minutes is heck to pay. I know, because I've had it injected into myself there. So
Okay.
anyhow, the patient said, why don't you put some Novocaine in there or something like that to numb things up? And I thought, yeah, why not? So I got in the habit of, I put the needle into the joint, shoulder, knee, hip, whatever it was. I'd inject some Novocaine and let it set there for about a minute. Then I just, leaving the needle in, I'd switch the syringes and shoot in the ozone gas, and everybody's happy, and that's worked great. And one day I'm thinking, you know what? I'm thinking to myself, I'm injecting fluid into that knee. Ozone is going into that knee and presumably stimulating all the stem cells and blast cells in there to repair things. Why don't I put other nutrients in there while I'm at it? That makes sense. So one by one, I tried different things. I tried different B vitamins. I tried different minerals. I tried different substances, like I tried sugar, for example. I tried various homeopathic agents. And over time, I came up with this combination of different agents that I put in the liquid along with the Novocaine. So these are things that the cells inside that joint will use to create the healing. Because the fact is that ozone itself isn't what causes the healing of that knee, because we actually regenerate cartilage, we regenerate tissue. Ozone's not doing that. What's regenerating the tissue is the stem cells and blast cells in that person's knee. When you have an injury, no matter if it's a chronic or even acute injury, signals are sent out from that damaged tissue that draw in stem and blast cells, and their job is to go fix the injury, and that's what happens. The problem is that 95% of my patients are over the age of 45, 50. Some of them are 60, 70. Their stem cells don't work very well. They even go out and get stem cells. They just don't work very well. Ozone stimulates them to work like young stem cells. So I take somebody who's 55 years old with bad knees. They tell him, you got to have a surgery. There's nothing we can do about this knee. But he's got stem cells and blast cells in that knee. They just don't work. So I'm taking ozone and I'm injecting it in there. And at the same time, I'm giving that knee all the cofactors for those stem cells, like the B vitamins and such. And that little combination, I call it prolozone, but that little individual combination works great to get rid of pain and to regenerate the knee. I would have to tell you, Judy, that I get pretty much every one of the patients I get have been told they need a surgery. Almost every single one. They've been told, Doc, I came here because the next step is they want to, put a total knee in, or they want to put a total shoulder in, or they want to give me a new hip, or whatever the deal is. And I don't want that. That's why they're there, Judy. So they're pretty bad cases. And I probably fix 90% of them. I mean, flat out fix them. I don't just help them out.
Give us, we need to give us some more stories. When they come in with pain, let's say they have a knee pain. Let's say it's a torn meniscus, right?
Okay.
Yeah, and you shoot that up. How long? Okay, so they're going to feel better initially, right? But then does it last? Do they need to come back for more?
Yeah. We find that roughly is 2-week increments. You're going to stick all this stuff in that knee. You're going to stimulate those regenerative cells to repair the knee. And everything you put in there is going to probably wear off around 10 to 14 days down the line. So you hit them again. So every 2 weeks, you give them an injection. And every time you do that, you're stimulating those cells, and they're doing a little bit of healing. And probably in the order of a minimum of like 3 injections to a maximum of like 7 or 8. You will have regenerated enough for that knee so they don't need you anymore, and they can go out and do whatever they want to do. Almost as though they have a new knee.
6 months, right? No, I get it. So it's a short amount of time, really, because you're throwing in all those nutrients to stimulate the stem cells, like you said. It's really helping that knee to take off on its own. And so that's for joints. What about for muscles? Like if people have muscle aches and pains, or they have a disease condition that has caused them to be chronically fatigued, and their system is run down, they're not sleeping, all that stuff. How have you found ozone working for those kind of things?
It's yeah. So you're going to give them in some of these patients that are pretty ill, especially if they have a lot of pain. Let's take like a fibromyalgia diagnosis.
Perfect.
They got all kinds of pain up in their head, around the back of their neck, and maybe in their lower back, maybe pains in their muscles all over. So there's a sort of a systemic aspect to this. So you want to give a systemic treatment, typically the blood treatments. We call those MAH, which stands for major autohemotherapy, but that's the blood treatment. And it's a systemic treatment. You're treating the blood, so it's going through every cell in your body. So you're treating every cell in the body. And at the same time, you can go into the muscles, you can go into the ligaments, you can go into the neck, you can go into the sinuses, you can go into the teeth, you can go into the jaw. Wherever their symptoms and problems are, I can inject ozone directly into those areas using this technique. And seriously, you'll take a patient who's been suffering for 20 years, and within a week, they feel remarkably better.
And you're only doing it as a MAH, meaning major autohemotherapy. That's the only way you.
No, we can do it in my clinic, and this is a good point. In my clinic, I have a sauna, so you can sit in a sauna, and the ozone gets pumped in, and gets absorbed through your skin. We have a colonic.
Just for the sauna, because that's my favorite. That's what helped me with my Lyme disease.
Okay.
When do you sit in there? How long do they sit in there, and then how long does the ozone get in there?
Okay, so they're going to be in there about 20 minutes, 25 minutes. The first 5 or 10 minutes are just to get them to heat up, because we want them to be vasodilated and heat up. And then for about 10 minutes, we run ozone gas in there. And then we give the ozone gas about 5 minutes to just what we call dismutate, or turn back into oxygen. So when you open the thing up, you don't have a room full of ozone. And so it's roughly about a half an hour in there. And you'll do it probably twice a week. With some patients, you can do more than that. You have to be a little careful with the sauna, because if you're not careful, they'll get a rash from it.
Yeah, and the reason they get the rash is
it's irritating. It's an irritant, and some people, their skin is just sensitive, right?
Well, detoxing. I know in my clinic, in my clinic, I did the sauna, and I noticed that when I did too much, then they would get the rash.
Yeah.
Or if they weren't detoxing, and I learned that really fast. If I could detox them regularly, which not everybody does, but that detox, because it gets rid of the toxins quicker, they don't get the rash as much. So, yeah.
Yeah, you just have to be a little careful.
Yeah.
And then we also use the ozone in the form of a colonic. So this is ozone instilled up through the rectum into the large intestine, in the concept of a colonic, which, if the listeners don't understand, a colonic is where you put a tube into the rectum. It goes, and you flush water in and out of the intestines. It's a cleaning sort of treatment, and it pulls toxins out of the body is what it does. But while you're doing,
just so you know, wait, Doc, this crowd, they're coffee enema fanatics.
Okay, yeah.
It's just the opposite. They really know about it. But here's a good question on that. Can they ozonate water instead of doing a coffee enema, for example? I mean, I suppose they could use the coffee. I didn't really think about that. But can they just do a bag that's ozonated with water and then use that as like an enema?
You don't want to do that, because the only way you can keep ozone in water efficiently is if the water is fairly cold.
Oh, okay.
Yeah, and you don't want to be putting cold water up there. That's not going to feel too good. Warm water just won't hold ozone. So instead, you inject gas.
Okay. So you're talking about like a rectal insufflation.
Yeah.
Okay. So you're not doing a colonic. You're not, because the water is not really flushing. Is it ozonated water that you're flushing, or is it just the gas you're flushing?
Okay. Colonics themselves are remarkable. Leaving aside ozone, they're absolutely remarkable.
Yeah.
Coffee enemas are really good, but colonics are even better.
Yeah.
And so basically, it's sort of like a super duper colonic, where we're putting the ozone in along with the colonic. But of course, if you don't have a colonic available, you can just put the ozone in. You can take your coffee enema, and after you finish with that, then inject ozone into the colon and go about your business.
I bet you that's one of the best ways to do it because you cleanse out
Absolutely.
your colon, the ozone gets in there, and you're getting rid of all
You
the
got the
garbage.
coffee detoxing the liver. It's great.
That's a great combo.
Yeah.
Do you also use it in other ways other than the sauna? You did the injections, you're doing the colonics. What is there any other way that you're doing it?
Yeah, there's a couple other ways that we'll use. And by the way, in my clinic, if depending on what your condition is, you may be getting all of these things. It's not always just one. You may be getting a blood, then you go into the sauna, then you get a colonic, and the other things that we do is you can inject ozone into the ear. So that's kind of interesting. You can also inject ozone up into the sinus cavities. It'll like flat out
We,
cure sinus
we, we
cavities.
preface that with the medical supervision because we don't want them to do that at home.
Yeah, I discuss this in my book. I wrote two books, one for professionals, one for lay. I tell people how to do it. But yes, you cannot inhale ozone. If you do, you will cough like crazy. And if you have asthma or chronic lung disorders, you could actually go into respiratory failure. So you have to be very careful about inhaling ozone. But Judy, you can go ahead and inject ozone gas right up the nostrils, into the sinuses, as long as you do it exactly as you're supposed to, and you won't inhale it. You can get away without inhaling it.
Yeah, we tend to be a little bit on the cautious side and let you guys
Yes.
do it in the
Yeah.
clinic. So
Yeah.
that's great. So the ears, women could do it vaginally.
Yeah.
They could do it the rectally. Guys could do it rectally, of course. And how long does it typically take at the clinic when you guys do all that?
Say again.
How long does it take typically to do that?
Okay, so a blood treatment is probably in the order of 45 minutes.
Okay,
The rectal treatment is fast. That's like 3 minutes.
right.
The colonic is more like a half an hour. The sauna is about a half an hour.
Okay, perfect. So all those things, where do you see the people getting the most benefits? Give us some stories, Doc, of some people who have had these different therapies and walked in, dragging their feet, not feeling great. I know that's how I was when I had my line, then walking out feeling like $1,000,000. Is there anybody that stands out in your mind of who you saw that big improvement?
Yeah, geez, that's basically what we do all the time. We do see people. It's a general internal medicine clinic that I have. So I see people from stage 4 cancer to autoimmune disease to chronic infectious disease to maybe Lyme to hepatitis.
Well, let's talk a minute
To
about the cancer because we do have a big cancer crowd here. And just give us some examples of some people who have worked with cancer, especially 4th stage, where they're
Okay,
tired. Yeah.
yeah, I have to say we do really good with cancer, and once again, for the most part, I wish we get other people as well, but for the most part, the people we get are they have stage 4 cancers. They're typically very ill, and for the most part, their oncologists have given up on them and sent them home. So this is not the best group of people to work with, as you can imagine. Uh, we actually do quite well with the majority of them, and we've got a whole system that we use. But ozone's a huge part of that. And every now and then, we'll have a patient that's getting this systematic treatment that we use, which incorporates a lot of things we've been talking about. And for whatever reason, they'll skip something. And they'll come back and they'll tell me, Doc, I skipped that for whatever reason, but I'm not going to do that again.
Because I see the difference, right?
Yeah.
So
Yeah.
what is the big difference that they see? Is it their energy? Do they sleep better? No pain? Like, what's the
Well,
biggest
these
difference?
people, for the most part, Judy, these people are getting chemotherapy. Now, they're either getting chemotherapy from me, I use low dose insulin, or they're getting chemotherapy from their oncologist, but they need something to kill the cancer.
So
And
you say that the ozone with the chemo is okay to use?
not only okay, it's actually it's malpractice not to use it, because what the ozone's going to do is going to take a patient that comes into me and says, you know what, my doc's been giving me cisplatin, carboplatin, and Gemzar, and he says it no longer works, and he sent me home to die. And I'll give them the exact same chemicals with ozone, and it works. So ozone ramps up the effect of chemo and at the same time protects the healthy cells. So the side effects are pretty much minimal.
Minimal.
I have a guy right now, for example, I'm treating. He's got colorectal cancer. He's got 2 nodules in the liver, and we just had his yesterday, so we did it on Thursday. He had a chemo treatment. After the chemo treatment, he left, he got on his horse, started riding around the valley, and this is typical. You like don't get any side effects.
Wow.
It's
So,
amazing.
so you're seeing it as working fine together. There's no problems, no contraindications, basically. Okay.
Absolutely. It's so synergistic with conventional care, and also, by the way, with radiation therapy.
And the medical doctors, the oncologists don't give you a hard time, or the patient a hard time, because sometimes, you know what happens, the patient wants to do it. This is the emails that I get now. And they're like, well, my oncologist refuses to agree to allow me to do anything alternative. He wants me just to do chemo. And so then they're in a fix because they know there's some things that might help them, but they're hearing about the chemo. So it's a tough place for the patient.
It's a horrible place for them to be in. But I'll tell you a great story. I love this story. Here's a guy that came to see me when he was about like 64. He had squamous cell carcinoma of his throat. He's a VA. The docs down at the VA said, we need to do radiation on your throat, which is the treatment of choice. He came in to see me and said, what should I do? I said, look, you just don't do that, do that. Plus, let's detox you. Let's give you some ozone therapy. Let's do all these other things, vitamin C, whatever we're going to do with you. And so he goes back and he sees the radiation oncologist. The guy says, look, you can't do that. It's going to interfere with my therapy. I will not treat you if you do that. So he comes back to me. He says, he's not going to treat me if I do that. So what should I do? I looked at him and I said, lie. Tell him you're not doing it. And he says, doc, I'm a Christian. I know I'm not supposed to lie. And I said, look, I'm telling you right now, I think you'll be forgiven for this one, but you have to lie and just do it. And so he did. He got the ozone treatments from me. And right after he left my clinic, he goes over there and gets his radiation treatment. So they do this every day, by the way.
Wow.
And so after about 6 or 8 weeks, his cancer's gone. One of the side effects of radiation in the throat area is you can lose your teeth, and you definitely wipe out your saliva glands. Your mouth becomes dry. You can't do anything. And so he comes back and he says, you know what? My oncologist said I'm doing so well. He can't believe it. And he wants me to talk to a group of patients there that have the same kind of cancer so I can give them hope that, the treatment's not so bad. And so I said, well, yeah, okay, well, tell him. So he goes back, he tells the oncologist, he says, you know what, I'll be happy to talk to your group and tell them about everything. But to tell you the truth, I didn't tell you, but the whole time this is going on, I'm getting vitamin C and ozone therapy from Dr. Shallenberger. And you know what the oncologist's response was? Well, you can't talk to my group then.
There you go.
Yeah, so the oncologists, it's a lot of them anyhow, most of them, they just don't want to know. I don't want to know. Don't tell me about it. It's out of my purview. I don't want to even know about these things.
It's a shame, isn't it, that we're not working together? That the alternative with the medical, we're not working together as a team.
Yeah.
It's a real shame. And
we need to break through that, because that's just craziness.
Yeah, because there's definitely, I don't bash the conventional medicine. I believe it's a personal choice that everybody has.
Sure.
But because the conventional medicine is so negative against alternative, it really leaves the patient in confusion, and that's not a good place for them to be.
It's horrible. It stresses them out, and then you got the family in there, and when you're battling these tough diseases, you're already stressed out to the max. To pile more on you is just is unfair.
Yeah, it really is. So we just want to leave, because we just have a few more minutes, I want to have people know that you have 2 books out, and we want to tell them about that so that one they could give to their doctor and one they could read. So tell us about those 2 books, Doc.
So the one for practitioners is called The Principles and Applications of Ozone Therapy. And that's got the equations in it, and it gets into physiology and talks about those sorts of things. It gets a little bit more technical. Truth is that most lay people are going to understand it anyway, because the funny thing is, when you write these books for doctors, they don't know any more about this than lay people do. They do know the vocabulary, so that makes it easier. But so I did write a book specifically for lay people, because the truth is that in a perfect world, every household would have their own ozone generator and know how to use it. There's a lot of things people can do at home. These treatments you don't necessarily need a doctor for. They're 100% safe. As long as you do the way I told you to do it, you would never hurt yourself. And you can use it on kids, old people, people with diseases, people who are healthy.
Just to stop you on that a minute, because I know a lot of people have been asking, what's the youngest that you, as far as children go, what's the youngest that you've used the, let's say the ear insufflation, something like that?
Probably, I don't get a lot of kids, to tell you the truth.
Okay.
Why that is, I'm not sure. But we have done 3- and 4-year-olders, and we typically give them rectals. There's a guy named Robert Mayer who died maybe 15 years ago, but ever since the late 40s in Florida, he was a pediatrician, and he reported on all kinds of pediatric cases where he mostly used rectal insufflation.
Wow. It's an easy way. I mean, they do it for pets. You just put it in, they just sit there for a couple minutes, we're done. Yeah.
Piece of cake, yeah.
So the book is for the layperson that tells them basically A to Z and using ozone and how safe it is. And
yeah, it's called The Ozone Miracle. Both those books you can get on Amazon. That one's called The Ozone Miracle, but it's like a cookbook. The first part of it is I explain a little bit of the history and the background data and some of the scientific data in a way lay people can easily understand it. And then I just go through cookbook. The next few chapters are about the things you can use it for, from ear infections to ulcers to whatever. And like you could look it up and say, for stomach ulcers, do this. For colds or viruses, do this. For hepatitis, do this. And then in the second half of the book is how you do those things. How you can do a rectal insufflation, how you can do a sauna, how you can make the ozone water and drink the ozone water, how you can use ozone oil, how you can apply it to your skin. So we go through all the systems and the procedures.
Basic. I mean, that's not complicated at all. It's one of the easiest. I think that's why I gravitated to it as well. It's one of the easiest, most versatile therapies out there.
Yeah.
Yeah, it works really well. Well, doctor, thank you so much for your time and sharing your expertise. I mean, my goodness, you've been at this since 1983. I don't even know how many years that is, but it's a lot of years.
That's a lot.
Yeah.
It goes by fast.
Yeah, it goes by fast. And what's cool about it is you're seeing the results, people getting better. The side effects are like 0 to none. And the thing is that it's just easy for them to do. So I appreciate you sharing all this. And if they want to go to your website, that again is
antiagingmedicine.com. Antiagingmedicine.com.
Excellent. Thank you so much, doctor. And for the viewers, stay tuned. We've got more experts like Dr. Shallenberger that will teach you much more about ozone and all the many uses. Thank you for watching. We'll see you on the next interview.